Brett Craig Stevenson, a case study. Date of birth 19th of June 1960, date of accident the 10th of January 2010. Diagnosis: incomplete tetraplegia at C5-6, fracture, dislocated, bifacial and head injury with post-traumatic amnesia lasting 11 days. The skull fracture at the left frontalis, the length 12 cm, depth 2 cm, which involves the limbic system. Showed temporary loss of recent memory, spasticity in the connection with right side extremities. The accident? Diving off rocks 3 metres high above the water. Surgery: C5-6, stabilisation and fusion, anterior and posterior. He also sustained lacerations of the left thumb. Symptom: spasticity in his lower limbs, mainly on the right side. He had an injection of botulinum toxin on the 17th of April 2010 into the right gastrocnemius soleus complex. He was unable to move his leg because of spasticity. After 1 year of hospital treatment, the hospital record stated, quote, "The deficit that he has in the upper and lower limbs is permanent. For longer distances, he is going to need a powered wheelchair and will also need a manual wheelchair to manoeuvre into the car." End quote. When Brett came to Dr. David Tai's Acupuncture Research Centre, he could stand straight, but was unable to move his right leg because of leg spasticity. After 2 sessions of acupuncture treatment, he can use a walking frame to walk into the clinic, a distance of about 10 metres. After 3 months acupuncture treatment, he can walk with crutches. Needle insertion released the tissue scarring at C4 to T1. The needle is inserted into the side of the scar and a deep interior layer of the scar is terminated to the facet. Needle insertion techniques aim to remove the scar tissue, stimulate blood flow, bringing better blood flow to the area, stimulate the receptors to heal the scar tissues. His body trembles, especially both legs automatically flex to the hip. The fingers of the left hand are more easily extended. Release the obstructive scar tissues, allowing the spinal nerve to grow. Stimulate the receptors, activating the potential for movement, which produces nerve impulses through the reflexes mechanism. This rebuilds the neural network, allowing neuron recovery. Especially the right leg spasm is released. It takes 30 treatments to completely release the scar tissue at C4 to T1. The scar is softened when palpated. Acupuncture treatment is focused on the lesion of the spinal cord, spinal nerve, and peripheral nerve, initiated from the original lesion point down to the lesion inferior spinal cord. The governor vessel or GV point between 2 spinous process of vertebra. The Tai-Chi point at the side of the spinous process of vertebra. The bladder meridian points. at the side of the spine initiated bladder 12 down to bladder 34 and bladder 41 down to the leg and foot at bladder 67. The patient has an incomplete lesion to the spinal cord. Needling is shown. The right extremity has a more severe lesion than the left. The left leg is able to control movement, and in the right limb, strong reflexes occur. Needling the point at the governor vessel, or GV, and Tai-Chi releases the obstruction and stimulates the receptors. Needling into bladder meridian points mainly improves muscle tone to stabilise the spine. Needling to the upper limbs. Needle insertion initially from the elbow to the fingers. When needling into the palm, heart 7, pericardium 7, lung 9, EUE 11, EUE 10 are painful, and the fingers are extended.
You can see this hand back to normal, and not only you can see he can control his fingers, and also he can use his hand.
Needling into the plantar, kidney 1, kidney 2, and bladder 67. The leg lifts up, it reflexes and is painful. Needling results in the release of muscle and tendon spasm, improving leg and finger movement.
And you can use that left hand. He's quite happy with that left hand.
Needling into the points on the palm and plantar can improve the nerve connection between the hand, foot and the motor cortex. After needling, the fingers are extended and able to move. After 6 months treatment, the fingers of the left hand are able to open and finger movement can be controlled, including doing stretching exercises and playing with a Tai-Chi ball. The right hand fingers take more time to show improved results. After 8 months treatment, the left side of the body, from the neck down to the leg, the muscle is toned and can control muscle movement. On the right side of the body, the muscles are still weak, and the fingers can be extended, but there is not complete control of the finger movement yet. Preferably insert the needle into the muscles and end to the tendons, along the individual muscle which goes with the coordinated muscle movement. Especially the needling is stimulated at the point in the muscle origin, and insertion and needling into the belly of the muscles. Before the nerve is completely innervated into the muscles, strenuous exercise could cause inflammation, especially causing the ankle to become swollen. After treatment, gentle stretching exercises are suggested. In warm weather, the patient feels the treatment effects faster and is more relaxed than in cold weather. Although following 1 year of hospital treatment and the hospital record stating that the deficit in Brett's upper and lower limbs is permanent, and that he is going to need a powered wheelchair. After 1 year of acupuncture, Brett is able to walk with crutches, and he uses his left hand to write his signature.